Welcome to Capitol Dateline. We're here on the floor of the Florida House of Representatives with Florida Speaker Will Weatherford. Welcome.
Thank you.
And Florida Senate President Don Gaetz.
Great to be here.
I'll tell you what, we're back after a couple of weeks, and you know there's been conversation about how civil the atmosphere is here in the Florida Legislature, and it's a contrast to what we hear about what's going on in Washington. Let me just ask you, are you two having something to do with that? We'll start with you, Mr. President.
Well, I understand that the Speaker gave a speech to a local group here recently where he talked about the contrasts between Florida and some other states that are dysfunctional, and Florida and what's happening in Washington. And I think we've learned this, that policy differences are important, sharp debate is important, sanding the rough edges off of policy is important, but it's also important that we get results, that we get solutions. And I think that the Speaker has led the House of Representatives in a way that Democrats feel included. Republicans understand that they have to make their case. The Speaker has been open and welcoming with ideas from the Senate. And that's the way we're going to get to solutions. We'll have differences. That's the way the framers set up our Constitution. But at the end of the day, we can have public policy decisions that are arrived at through civil discourse and not finger pointing. And that's what the Speaker, Will Weatherford, has led us to do.
I see you nodding and smiling.
Well, first of all, what I've learned is if I just do what the Senate President wants me to do, everything works out fine.
But I like 1,000 copies of that.
That's right. But the truth is, you know, the beauty of it is, I think, that our relationship started years ago, and trust is not built overnight. And so our ability to work together comes with trust and constant communication. And so whether it's our offices communicating with each other, whether it's us bumping into each other in the hallways or having a conversation on the phone or whatever it is, there is a trust that's been built up. And so if the Senate President tells me he's going to do something, I know he's going to do it, and I hope he feels the same way about me, and I think he does. And that allows you to do great things on policy. It doesn't mean that anybody's going to rubber stamp anybody else's policy, but if the Senate President sends me a great ethics bill to the House, which he has done, then what it means is we're going to work really hard to try to pass it. And if there's ways for us to make it better, we'll do that. But we have a trust that at the end of the day, when the gavel goes down on day 60, the hope is that Florida benefits from our service, and that, you know, our personal ambition or anything like that is always going to the wayside. What we should be focusing on is what's good for Florida, what's good for our membership, and how do we move our state forward. And that's been our focus, and I think that's been the recipe for success the last few weeks.
Well, how are you, President Gaetz, getting along with your Democratic counterpart, Senator Smith?
Chris Smith is a great guy. He was minority leader in the House of Representatives with Speaker Benz. And I found Chris Smith to be an honest, thoughtful, fair partner. My hope is that he would say the same about the Republican leadership. And so far, we've had bipartisan support on big issues. Now, look, there are Democrats and Republicans, there are conservatives and liberals. This is a diverse state. We come from many different points of view, many different local interests. We're bound to have disagreements, and they're going to be partisan votes. But we can have partisan votes, and we can even have, as I said, sharp debate without it getting personal, and with people understanding that at the end of the debate, we have to synthesize our points of view and come to a solution. Chris Smith is a great leader, and he's been extraordinarily cooperative.
And you with Leader Perry Thurston.
Yeah, it's funny. We were on the floor the other day, and whenever you recognize a representative from the chair, you always say, you know, Representative Thurston or whoever the member is. And on accident the other day, I said Representative Perry, and the reason I did that is because we're so close that we frankly call each other by our first names. And so I had to correct myself and call him Representative Thurston. But Leader Thurston has been just a wonderful partner. And again, it goes back to trust. And in the very beginning, we talked about the type of House we wanted, the type of discourse we hope to have, the type of debate we hope to have. And if we could build a trust that, you know, no one would ever have a surprise for one another, but that we would have honest, open, as the President said, sharp debate, then we could actually get things accomplished, and it wouldn't be personal debate, it would be policy-based debate. And that's what we've had, and I hope it continues.
Well, let's talk about some policy and some important policy. To me, anyway, the biggest issue of the session thus far has been Medicaid expansion, whether to expand or not. The governor, Mr. Scott, is for Medicaid expansion under Obamacare, at least out 3 years. And committees in both the House and Senate have said, nope, don't think so. We're not going that way. And you, Mr. Speaker, have been most outspoken in saying that's not the right way for Florida. Could you give us a brief summary about what most concerns you about moving toward expansion of Medicaid, which would include probably 900,000 Floridians if expanded under the Obama paradigm?
Well, there's a couple of problems with it. I think the first problem that we have is it's relying on the federal government to pay for something that they have no ability to pay for. It seems like every other month they're having a debate about the debt ceiling, but yet they want us to believe that they're going to pay for hundreds of billions of dollars of Medicaid expansion in every state across this country, and it's not sustainable. And on top of that, what I think the other big challenge that we have is you want to be careful about growing a government program, because there's nothing wrong with providing health care to Floridians. We want to find more people to have insurance. That is something that is a laudable goal for our state. But to put people on a program like Medicaid that already has challenges, that already has access issues, if you have Medicaid, the odds are you have a challenge getting specialists to see you. So before we put another 1 million people on that system, we ought to think through what the other options are for our state. And I have concerns about creating a dependent society on government. And so what I think the Senate President and I have worked on, and where we are right now, here we are in just a few weeks into session, the conversation is not about growing government. The conversation is about health care for our state, and how do we do it in a way that embraces the private sector solutions as opposed to government.
Mr. President, what you hear from people who would like to see Medicaid expanded is, the federal government's going to provide full reimbursement to the state for at least 3 years for the expansion. What's going to happen if you don't take that money? I believe the committee in the Senate dealing with this under Senator Negron has basically said we can come up with a state paradigm that's different from Obamacare and still draw down some funds. What is he talking about, or what direction is the Senate going in? Toward a private insurance program that maybe is based on managed care? Bring us up to date.
Well, first, I think the Speaker did the right thing by laying out the reasons why we can't always trust the federal government to do everything that it says it will do. Not because everybody in Washington's a liar, although there are a few liars up there, but because sometimes fashions change and priorities change. I was a superintendent of schools. I remember when the federal government said they would always pay 40% of the costs of IDEA. That's the federal program to provide extra educational and healthcare services to disabled students. You can count on it. 40%, you're covered, it's a guarantee. On their best year, they haven't paid any more than 23%. And the costs have been shifted onto local school districts and taxpayers in states. So it's not that bad ideas necessarily turn into bad results, although that happens. It's that sometimes fashions change in Washington. So the Speaker has taken a cautious view that we can't rely upon people who can't even seem to balance a budget or even have a budget or even pay for the defense of our country. So I think that's a pretty cautious view. Now, where the Senate is we've said no to Medicaid as we know it. We want to go, I think, further than maybe some people would like to go, and that is we'd like to end the Medicaid system in Florida as it has become, as the Speaker said so correctly, a system that makes people dependent on a health care process that doesn't provide them either access or sometimes quality. And it's certainly something that providers and taxpayers and patients don't seem to like. So we want to have a system that would rely on private insurance. Perhaps we can provide some assistance to people who can't afford private insurance to be able to buy it. 70% of the people in this state between 100% of poverty and 138% of poverty are the working poor. They have jobs, they're trying to support their families, but they can't provide health insurance. So we think there's a private sector solution. Senator Bean as well as Senator Negron are both working on ideas that would have us buying into the private market, not expanding Medicaid as we know it, actually ending Medicaid as we know it for everybody and using a private sector solution. That gives more people more choices, family plans, individual plans. Folks can have skin in the game. They can have incentives to have healthy lifestyles. They can have co-pays so that they have some personal responsibility. That's very different than what President Obama has asked for and what Governor Scott has endorsed, and that is simply expanding a failed Medicaid system. I'm encouraged that the governor has now started to say, and I can't speak for him, but he started to say that he sure wants to listen to the House of Representatives and the Senate, and hopefully we can come to a solution.
Only about a minute left, Mr. Speaker. What I've just heard from the president is that you're not saying we're not going to cover that cohort of 900,000 people. You're saying you're looking for a new way, a different way than the Federal Health Care Act to do it.
I'd say we're looking for a private sector solution. And whether we covered all 900,000 people or not is up for debate. I will tell you, if you're a child in the state of Florida, you're covered up to 200% of the poverty rate. If you're a family, have a mother or father with a small family, most likely you're covered under Medicaid if you meet that threshold. If you're pregnant and you're a female, up to 185% of the poverty threshold. The challenge is, if you're an able-bodied single adult, at what point is it the government's responsibility to provide for your health care? And I think there's a debate that needs to take place about that in this country. We cannot afford, as a government, to pay for health care for everybody. There are able-bodied people in this country that are going to have to take themselves up by their bootstraps, work hard, and provide for health care for themselves. We should believe in a safety net. We should find that safety net, and we should make sure it's strong. But we have to define what it is. And I think this debate will be about finding a private sector solution to define the safety net and provide as much coverage as we can to the Floridians who need it.